There are several reasons why we may keep getting sick despite taking precautions and maintaining a healthy lifestyle. Some of the common factors include exposure to pathogens. We are constantly exposed to various pathogens in our environment, such as bacteria and viruses. Even with proper hygiene practices, it is challenging to completely avoid exposure to these microorganisms. They can enter our bodies through contact with contaminated surfaces, airborne transmission, or interactions with infected individuals, leading to recurring illnesses. Weakened immune system. If our immune system is compromised or weakened, it becomes more difficult for our bodies to fight off infections. Several factors can contribute to a weakened immune system, including chronic stress, lack of sleep, poor nutrition, underlying health conditions, and certain medications. When our immune system is not functioning optimally, we are more susceptible to recurrent illnesses. In complete recovery, sometimes, we may not fully recover from an illness before being exposed to new pathogens. Insufficient rest, rushing back to our daily activities, or not completing the prescribed course of medication can leave our bodies vulnerable to reinfection or new infections. Environmental factors. Our surroundings can play a role in recurrent illnesses. For example, if we live or work in environments with poor air quality or exposure to pollutants, our respiratory system may be continuously irritated, making us more prone to respiratory infections. Additionally, living in crowded or unsanitary conditions can increase the risk of contagious diseases spreading within communities. Seasonal variations. Some illnesses have seasonal patterns, such as the flu or common cold. During certain times of the year, these viruses tend to be more prevalent, increasing the likelihood of getting sick repeatedly within that period. Lifestyle habits. Unhealthy lifestyle choices can contribute to recurrent illnesses. Factors such as a poor diet lacking in essential nutrients, inadequate hydration, lack of exercise, excessive alcohol consumption, or smoking can weaken our immune system and make us more susceptible to infections. Underlying health conditions. If we have underlying health conditions or chronic diseases, our bodies may be more susceptible to infections. Conditions such as diabetes, autoimmune disorders, respiratory disorders, or heart disease can weaken the immune system or create an environment that is more conducive to infections. It is important to note that recurring illnesses can also be a sign of an underlying medical issue that needs to be addressed. If you find yourself frequently falling ill or experiencing persistent symptoms, it is advisable to consult a healthcare professional for proper evaluation and guidance. To reduce the frequency of getting sick, it is essential to maintain a healthy lifestyle, including a balanced diet, regular exercise, adequate sleep, stress management, and good hygiene practices. It is also advisable to stay up to date with vaccinations, minimize exposure to sick individuals when possible, and take precautions in environments where infections are more likely to spread.